their expectations and why this is important for us to be doing here as part of our research study. We are in our phase 2. So NICU has already started with using the bottles. We're rolling this out for postpartum yesterday. So this will be for any moms who are trying to really exclusively breastfeed. We really want to be able to encourage them to use these bottles because it does help mimic that same flow that comes out of the breast. So if you have a mom that's a little bit on the fence, Kiana had a patient yesterday who was like, hey, I only want to exclusively breastfeed. She told her about this bottle. She put some formula in that bottle. So this way that mom felt a little bit better about, hey, I just want to make sure that there's something that I can use. And it worked really well for them. So she was very appreciative of it. The bags that we have the gift bags are in postpartum hanging. Please give out one of those per patient who we're giving the bottles to, not just, anybody, everybody. So there's a log sheet that I would like everybody to fill out. So please put down the patient's PIN number. If there's an indication that was really just for NICU, but, happy for you guys to put in there, 39 weeks. I think Kiana put this baby had a weight loss of 7% or something like that. So she just made a little note on it. But this will be good for us to reference later on. We have 300 bottles that we're going to be using. So once we're done with this, this phase 2, then we can, move on to our next thing. So this is Lauren.
Hi, good morning, guys. How are you today?
So, Lauren, please chime in and let me know how I can assist you if you need anything.
Yeah, I just want to know if I can have 10 minutes of your time. It's early. Can you guys hear me okay?
Yeah, it is.
Okay, awesome. Well, I have exciting news. I'm over here in Europe, and USC is becoming globally famous for your research. I don't know if you came last month, actually, to the innovation party that we hosted celebrating the publication that was in Advances of Neonatal Care. And that was done in our phase 1 research with you guys. So the study is really designed in phase 2 to be incredibly minimally invasive. I'm a nurse practitioner myself, and so we didn't want it to be anything additional that you guys have to chart in the EMR. But I'll just give you a little bit of background on the product and how it was developed to really make a difference to help moms that want to nurse longer. And let's just go ahead and share my screen. Do you see slides?
Not yet.
Not yet, okay. Microsoft Teams,
if you go to share on the top, like where it says right next to leave, if you press on that and then press screen, there you go.
You can see? Okay, great.
Yeah.
Well, thank you guys so much for the work that you're doing. And my goal as a nurse practitioner, when I stumbled upon this problem from the research I was doing in the NICU actually, of preterm infants that were suffering from necrotizing enterocolitis and sepsis, was to figure out the most impactful way we can prevent that imbalance of gut bacteria that leads to not only fatalities, but complications for us as clinicians. And so the research really began in the microbiome development and looking at the 7 determinants of what is necessary to form a really optimal microbiome that helps inform the way you eat and think and function for the rest of your life. And in short, we really have these first 3 years of life to nurture and put in the good microbes that end up becoming essentially the real estate for how you synthesize vitamins, for the neurotransmitters that you secrete. And so that's where my work in my PhD really began, is how do we optimize that so that we have less autoimmune diseases, less metabolic and neurodevelopmental disorders as we continue developing the next generation. And so it was hearing over and over again after realizing that providing breast milk for longer is the most critical thing that we can do as clinicians. And I was really curious, okay, like what at bedside, like in the environment you're in, postpartum or in NICU, is happening that's preventing women from getting a good latch and going home and successfully breastfeeding for a minimum of 6 months, like the World Health Organization recommends. And the National Science Foundation actually awarded me up to $300,000 just to go understand the barriers to breastfeeding. So I was in California, I was also in Nepal, just listening over and over to women describe the same thing. They said, the shape, the feel, and the flow of this standard bottle, when I introduce it, I really struggle getting baby back to breast. It's like they get used to this faster flow and they're really impatient and they start biting my breast. And I decided, okay, well, how do we solve for that? And when I was looking at the data, actually, they also explained having some lack of support during the breastfeeding journey. So I'll pepper back in at the end how we're helping you guys when the patient goes home to continue supporting them if they need help with latching, maybe it's positioning. But we see most of our patients come through from 3 to 5 a.m. when they have nobody next to them to really help support them in their feeding journey. I'm gonna go quickly in respect of your time. So it was actually this data here. So this is in our publication together in Advances of Neonatal Care. The top global feeding expert, Dr. Britt Pados, studied how fast milk is coming out of every single bottle. And some of these products, like I know you guys have Tommy Tippy and the Similac nipple, are flying anywhere from 5 to 85 milliliters a minute. So what that means is, and what we have quantified in the phase 1 research with you, is that's doubling the length of stay and consult cost. And these fees are $154,000 per infant, but what we learned is $132,000 of per infant is not reimbursed by insurance companies to your hospital. And so that was really the metric that we needed, because I'm sure you care as much as I do about not choking infants. But we really needed this number to get more purchasing departments to pay attention to this issue. And so what that means is by slowing the flow, as we have for the very first time, from actually 3D scanning breasts to start, and then really modeling for the very first time the microfluidics of breastfeeding at every stage of the baby's development. So you guys are getting a preterm flow, you're also getting a birth to 2-month flow, and that is the very first in 200 years of making bottles that is actually modeled after the female and maternal physiology. And so I'm really excited because this is how we differ in terms of controlling that flow to under 2.2 milliliters a minute, which is what the data demonstrates preterm infants need. And then we do the same for every stage of the baby's feeding journey. So when the mom goes home, she can keep getting an updated flow and have those seamless transitions between bottle and breast. And I'm very excited about our outcomes. What we're looking at right now with you guys is, okay, now how much do we save your hospital system after you have switched over from Abbott to our safer data-driven flowing product? And what that means is with the money you save from the disposables budget, it can go towards much better use of funds, hopefully raises for the staff. And what it means for moms is that actually we've reduced latching time by 83%, so that fussiness in the middle of the night or when you're trying to get baby to bottle or to breast, we've reduced that by 83% compared to other products. 66% of moms saw that there was reduction in colic, and 100% recommended that they would give this product to another mom. And I'm just very grateful for your work at USC. Rachel, Leah really spearheaded this innovation project. So so that we can really change the industry standard moving forward for other hospitals, because without this information, we were stuck without a safe tool to provide our patients. And I'm just opening that up for any questions that you guys might